But the last part is actually the home exercise part of it. Now, what I will usually do is I will start, as long as it's not before, let's say, the 30th week, I will actually try to start female patients with a McKenzie assessment. And if they are able generally to do a flexion series exercise until they can no longer do it due to the growth of the belly, then that actually is really good for kind of taking that hyperlordotic pain away and controlling some of that low back pain response. At some point, though, those exercises just won't work because there's not enough space to work into. And that's where we like to utilize a lot of exercises that we've learned from doulas and midwives. So things like the sacral counter pressures, hip squeeze technique, teaching clients in here how to take a bed sheet or a blanket and do a bit of like a rebozo sifting to kind of take some pressure off the belly and off of baby. Teaching patients how they can do a little bit of a controlled side posture stretch for themselves at home, how they can actually take the contact that we're finding to adjust on the tailbone and teach a partner how to put a similar pressure into those areas. Those are all similar concepts that midwives and doulas will teach patients. And we know not every patient that comes in here has access to a midwife and a doula. So we view that as kind of an obligation to pass that self-empowerment along to patients so they can have that knowledge and be able to help themselves outside of our office as well too. Because after all, that is where the rehabilitation name in our practice comes from. Self-empowerment always has to be a critical piece of any success that we have with patients.